Hi, this is Dr. Adam Proper, and I'm your family Westport chiropractor. And I wanted to talk to you about posture and why posture is so important.
Hi, this is Dr. Adam Proper, and I'm your family Westport.
Um, Posture is so important because it not only aesthetically shows health in an individual, it actually has a very significant connection with the nervous system and the way the body functions. Because your spine and brain and spine are really connected through the spinal column, which is the main girder of your posture. And when poor posture is evident in children, specifically when they're doing a lot of computer work and they're texting, their head is really forward of their body. They're in sports. You find that if they're pitchers or baseball players or hockey players, lacrosse, soccer players, their bodies are imbalanced. They get knocked around from trauma. Trauma can affect the spinal joints or vertebra, which misalign out of alignment. And this in turn causes congestion of the spinal signals between the brain and the body, and congestion and inflammation in the joints themselves, which blocks blood flow, nutrient osmosis to the discs, and these shock absorbing pads between the bones. So over time, you can start to see people aging through their posture, and what is considered normal posture as one ages into their 60s, 70s, and 80s, where they're bent over or stiffer, is really in a chiropractic setting an abnormal, neglected posture. And it's a posture due to years of trauma and neglect. So I want to tell my patients and all of you listening that it's important that you come to a chiropractor, because having your posture managed is a very, very specific endeavor. And getting your posture back in balance is most often correctable, but yet will make your body increase its vitality, energy, and function. And the most important thing about posture when it comes down to spinal misalignments, so what chiropractors call subluxations, is it blocks the intelligence of the body, the connective messages between the brain and the body, from sending their signals to the desired locations in your body. For example, cells, tissues, organs, you name them, like heart, lungs, digestive, intestines, ovaries, uteruses, bladders, eyeballs. Any cell or tissue that's really living in the body is connected to the nervous system through the spinal cord and through the brain. And the spinal column is really made of 24 vertebrae that move segmentally, that are supported by discs, or a disc, which is a shock-absorbing neurologic pad. It's not just a cartilage, it's a neurologic living tissue that really, by design, relies on its health and function through motion of the joints. When the joints don't move, the discs die. And this creates chronic inflammatory responses in the body, which you can see on an X-ray, looking like calcium deposits in the disc area, or degeneration where the discs are starting to narrow down, and you start to see this calcium buildup in the spine. And I see this in young children beginning as early as 7 or 8 years old because of trauma. They fall off the bed, they fall off their bike, they get in fights with their brother and sister, they play sports, they get knocked around. Birth trauma, being born and having their necks twisted and their bodies pulled and twisted, whether it's a normal vaginal delivery or a C-section delivery. All of these things contribute to the traumas a child will face. And OSHA has kind of documented that a person or a child between the ages of birth and 10 or 11 years old can suffer 1,500 different traumas to their body. And as parents, we all know that traumas are, secondary to the word child. So the fact is, your children are under tremendous stress, trauma, and a lot of these things are ignored because, quite frankly and honestly, people are afraid to bring their children to a chiropractor. Now, why they're afraid is because they think chiropractors are going to be violently twisting and pulling their spines and causing problems, where it's actually the opposite is true, because really in the 21st century chiropractic, Chiropractic is very gentle. It's very specific. We understand the nervous system. We understand how to put the right forces at the right place at the right time to relieve the stress in the body. Some of these techniques are so gentle that they basically are no more than a tap of the vertebra with an instrument, or a very gentle push with the hands, called the hand done adjustment. And we've had infants in our office. I just had a newborn baby who's only a couple of days old come in for his first spinal checkup, which is really the state of the art. If you really want to look at how would you keep your body healthy from birth, is you check your spine right out of the birth canal, right after birth. And we can do that effectively and check all the cranial joints, make sure the brain and the spinal cord are in good, healthy state to support that baby's function. So moms, dads out there, if you're really serious about your children's health, if you really see that their posture is out of balance, you can't correct it by scolding them or telling them to sit upright, or putting them in a gym and doing exercise. This is a fundamental spinal condition, much like crooked teeth would be a dental condition. You'd have to get braces if a child had crooked teeth. The same goes with if you have a poor posture, you have a crooked spine, then basically you need to have a chiropractic assessment, because chiropractors are the only doctors in the healthcare system and on this planet that really can assess, change, and find the neurologic cause of the spinal maladies or imbalances. And this is really critical for health as we grow older in our society, and we get away from sitting and doing technical computerisms and iPhones and all that. And as we age, and it's my observation too, as a chiropractor practicing over 30 years, that our children are starting to have more and more health issues because they're doing less and less for their posture than they did back 30 years ago even. So as adults and parents, I'm sure you can agree with that. Children are more or less, they come into our office and they've been attached to their cell phones and they're looking down at their floor, or they're carrying heavy backpacks, or they're putting a lot of stress in their body. They're usually in chairs all day long, sitting behind computers if they're home watching television. So you can see that this is a very, very dynamic problem. And mark my words, it will lead to more diseases in children that you might not associate with posture, but I can tell you something. It's a signal that our bodies are breaking down when a child is constantly sick, has constantly colds, gets the flu, fevers, and doesn't recover properly, is fatigued, has viruses, and can't really cope with the environment well as poor nutrition will kind of weaken that body. But posture is the fundamental underlying cause of a structural or physical component that will contribute to your child's poor health. So I wanted to get this message out. It's really important to find a good chiropractor in your area. In our office, we usually offer parents to bring their children in for a free consultation so that we can have a conversation about this. We're very children friendly in our office. We don't scare children. We explain to them, we talk to them and reason with them, and we expect their parents to set a good example, because parents, you're the leaders of your children's health in the family, moms specifically. So moms, you know your children. If they're not doing well, if they're involved in sports, if they're constantly on their iPhones and computers, if they're carrying backpacks, if you notice that one shoulder is higher and one hip is lower, if their heads are forward, if they're kind of looking, if you look at their backs and their shoulders are out of balance, then we're talking about the beginning of a postural distortion that is a signal for neurologic dysfunction that can lead to illnesses, diseases, and other maladies that you might not even suspect would go wrong, including extremity problems, ankle, knee joint, hip, shoulder, and wrist problems. So these are all considerations for you to see a chiropractor, and anyone really with a spine and a nervous system and a brain should have that spine, nervous system, and assessed and evaluated, just like you would have your teeth assessed or your toes assessed. you need to have a spinal assessment. And that's my message for you today. So call our office. You can call our office. We're in Westport, Connecticut. You can find us on the internet. My website is right here at properchiro.com. And I invite you to get with the chiropractic program. Winning in health means winning with good posture and a healthy spine.